If giving guaranteed healthcare to all us citizens required banning certain activities, smoking, supersize sodas etc., would you still be in favor? What would you be willing to make illegal? Yeah, these are the kind of perverse outcomes you always get from prohibition. Really, most vices are their own punishment anyway. You become an alcoholic, you die 30 years too soon, alienate your family and piss yourself in public from time to time. As long as vices are taxed appropriately, then you can go fuck yourself with your morality-based healthcare rationing systems. I mean, think about it. You start making healthcare contingent on not taking unnecessary risks, then you've got an impossible amount of shit to ban and an awful lot of invasive monitoring to do. It's way less efficient than taxes and completely unfair unless it's applied consistently across the board, something that you'll quickly realize is impossible once you start trying. Imagine losing your healthcare because you got fat. You already have to suffer being fat and having to re-buy all your clothes. Losing your healthcare on top is double jeopardy. Imagine a world where you can't smoke the odd joint without losing your healthcare, but you can do parkour or motocross or base jumping to your heart's content. Imagine a world where every drink you buy has to be registered with and approved by your healthcare provider to make sure you don't have too much. The only alternative being to ban alcohol altogether. You bad supersized sodas, you've surely got to ban those supersized burgers and fries your nation is famous for. The whole idea is dumb, immoral, and completely unworkable. Also, why do alcoholics, fat people, etc. not deserve health care? Because they brought their healthcare needs on themselves? The same could be said for women having babies or computer workers needing glasses or athletes needing knee reconstructions, but for some reason those reasons don't come with the big side order of judgment. The people who deserve healthcare are the people that have health problems. Edit. Wow, thanks for all the awards and upvotes, I'm humbled. Wishing you good health, kind strangers. Not only this, but why is the person fat? Why is the person an alcoholic? Etc. Therefore, do they have mental health issues or were they abused and need therapy? And if so, they require healthcare? Boom, logic voided. We don't get fat and become alcoholics just because we had too much fun. This. People aren't sitting around saying, you know what sounds great? Getting addicted to these painkillers. I've seen reports saying that up to 2/3 of addicts have been traumatized. Access to healthcare that includes mental health care is vital. Yet, let's also not forget the people that got addicted to painkillers after some major surgery, when they needed to, kill pain. Exactly. This is why food moralizing doesn't even logically work, let alone how it leads to disordered eating, poor shaming, and all kinds of things that also aren't good for anyone's health. How about if we just start from the point that people do as well as they can? Exactly. 3 ways this goes bad quickly. Every government that gives nutrition advice has reversed/revised their official advice multiple times. Health science gets things wrong for a while before it improves. Hysteria, eugenics, smoking, etc. DNA testing is already used to deny people care. So if somebody has the genetic marker for predisposition to breast cancer, who decides the rules about that? If they have siblings or children who haven't been tested, who decides whether that information gets put on those people's records and it affects their care as well? They say the road to hell is paved with good intentions for a reason. That's a divisive question and has brought a number of interesting answers out. The countries that have taxpayer-funded healthcare have a number of ways they suggest dealing with this kind of thing. The main one from a healthcare point of view is education rather than restriction. The primary way for a government to offset the added costs of healthcare is to tax the shit out of the activities like the ones mentioned. There are no restrictions to what you can eat or drink or how much tobacco you can smoke, but the tax added to their purchase can absorb some of the added healthcare costs associated with them, as well as acting to discourage some from using them to excess. Edit. Rereading the question, the only one I would consider making illegal is smoking, as that affects the health of people other than the smoker. The reason it won't get banned completely is the amount of tax it brings in outweighs any public health concerns. Yeah, Australia does this. Cigarettes cost about $50 a pack here, but they're still available everywhere. And no, the extra money does not find its way back into healthcare at all. Health Minister, we should make laws to make people healthier. I know. Let's ban vaping. But not smoking. Just the thing that studies have shown help people quit smoking, we'll ban that. And say it's for health. Just to clarify, if they were banning vaping and smoking, I would believe it was for health reasons. And our health minister is a total POS, so I can't believe anything he says, much less this crap. I'm reasonably certain US Comstock law is mostly repealed now, but the Patriot Act created a whole new set of problems, especially before ebooks and cloud sharing, e.g. for one of my American-based counterterrorism courses, we could not legally get copies of Tom Winteringham's books. He was a radical left veteran of Spain's Civil War who in World War II helped invent Britain's Home Guard units, then spent 1940 publishing books with diagrams and recipes for domestic terrorism against invaders. His books and recipes work really well even if you've not got Nazis on your smaller islands planning to invade you next. So the Patriot Act got in the way. Happily we wound up getting them in labelled as WW2 ephemera from an Australian bookshop. I like to think Mr. Winteringham would have appreciated our little ruse. As for Canada, the Glad Day bookstore in Toronto had many fights with Canadian Customs and American CBP over the years.